el valor agregado que le da Google a nivel mundial y en México específicamente al mercado de la salud. Y 3, cómo el equipo de Google México específicamente trae mejores prácticas de otros lugares del mundo donde tienen un punto de experiencia en el área de Internet, conectando al mercado de la salud con el Internet. Hemos ofrecido soluciones y cómo esas soluciones en verdad han sido el resultado de conversaciones que se dan entre ustedes, los líderes de la industria, y nosotros los líderes de Internet. No vamos a salir hoy de aquí con una solución preempaquetada para ustedes. La solución se va a dar en lo que ustedes nos permitan establecer una dinámica en la que ustedes tengan cierto interés en lo que nosotros platiquemos hoy, y a partir de ese interés podamos conversar con ustedes en cuáles son sus objetivos, y nosotros con nuestra plataforma y con nuestro conocimiento del Internet podamos ayudarlos a ustedes a lograr esos objetivos. En otros países del mundo se han dado grandes pasos en acercar a la industria de la salud con la industria de Internet y cómo usar las plataformas de Internet para beneficio tanto del consumidor final, del paciente, en el caso específico de médicos también, y no solamente es en el caso de aquellas drogas que son recetadas, sino también over the counter o cualquier otro tipo de servicio o soluciones que hay para los diferentes segmentos. Un poquito tocando en cómo va a ser la agenda del día de hoy. Vamos a estar aquí aproximadamente desde que llegaron y se va a finalizar nuestra plática, conversando un poquito con la colaboración de Amy Cowan, quien es la gerente de industria de salud en Estados Unidos, y ella tiene muchísima experiencia y nos va a traer un poquito cuál es ese valor agregado de Google a los clientes que tenemos en el sector salud. Yo voy a hablar un poco del panorama general y la visión de Google hacia el sector de la salud. Luego yo voy a regresar con ustedes y aterrizar un poquito esa visión y ese valor agregado a lo que es el mercado mexicano. Voy a presentar un poquito cifras de oportunidad y de ciertas tendencias que hay en Internet para el mercado de la salud, y presentarles un poco de ejemplos de qué es lo que podemos hacer por ustedes, cómo interactúan los usuarios con Internet, cómo interactúan los doctores, cómo interactúan los pacientes, cómo interactúan los consumidores en general con Internet. Y luego al final John Farrell, nuestro director general, va a hablar un poquito del panorama general de lo que es Google, México, y va a moderar una sesión de preguntas y respuestas. A mí me gustaría compartir con ustedes algunos temas de origen. Voy a sacar aquí para que no se me olvide ninguno. En sus carpetas tienen unas encuestas. Sería muy amable ustedes que por favor llenen esas encuestas, que nos den información bastante valiosa para nosotros en cómo fue su experiencia el día de hoy y qué es lo que necesitan ustedes nosotros para el futuro, y cómo contactarnos si quizás tienen algún tema de interés que quieren platicar con nosotros. Bueno, ya vieron que hay un coffee break, bienvenido al servicio de coffee break a su gusto. También tenemos baños en la parte externa de nuestra oficina, en el área de los ascensores, hay un pasillo. Para acceder a este baño necesitamos una llave que en el registro se lo puede facilitar. Y al final de la presentación, al final de las preguntas y respuestas, tenemos a nosotros hoy aquí, pero lamentablemente por razones que no están en su control, no pude estar, pero bueno, tenemos la tecnología de la videoconferencia, y Amy nos va a acompañar y va a presentar un poquito sobre el panorama general de Google para la salud. Entonces los dejo con Amy, muchísimas gracias. Y voy a hablar en inglés, entonces algunos de ustedes tienen sistemas de traducción. Aquellos que no lo tengan y lo quieran, por favor, avísenos y se lo suministramos. So, thank you, Amy. I leave you with our audience here today.
Buenos dias. Thank you for having me. My name is Amy Cowan, and I am on the health team in the United States, and have been working at Google for 6+ years, focused specifically on the health sector. Today, it's my pleasure to talk to you about why health matters, in the United States, globally, and specifically in Latin America as well. First, I thought I would kick it off with kind of just a perspective that we find here, which is, as you can see by this small joke, search has become an integral part for doctors and patients in every communication around the globe. Whether it is the patients come in and ask for information and try to self-diagnose, or doctors have questions and look to the internet for information. The search has really become the center of that dialogue. So today what I would like to talk to you about is Google's mission, how that mission relates to the global healthcare market and our commitment to it, and then share with you 5 digital trends that we see for global healthcare marketers. To start with, when we think about what our founders started Google with, was a simple mission: to organize all of the world's information and make it universally accessible and useful. When you think about that and thinking about how that's expanded, we first started just looking at how do we organize the world's information on the web. And we've grown to take that to even offline content, where we're scanning books and libraries around the world. We're organizing news content. We're solving for enterprise companies and helping them organize their own content, which really is a large task to try to take all of this information and really to make it easy to find and easy for people to access the information. When we look at health, it's no small challenge or no surprise why Google has a large interest in health. People are trying to find information about health, and there's content, not only online, but also tons of information offline that patients and doctors are trying to have access to. In the United States, we have looked at some of these challenges in regards to health, and a small set of software engineers decided to try to say, how do we look at the wisdom of crowds? How do we look at the number of queries that are happening around the world and try to actually create some predictive models that will help us better understand what's going to happen in the future in regards to health. And this group of software engineers partnered with our Google.org, which is our foundation, and said, well, one such health activity that really kind of would have a global impact is really the flu. And what we did was looked at the number of queries, flu-related, that were happening in the United States, for example, and sorry, are you able to hear me?
Yeah. Yes.
Ron, can you hear me?
Yes, we can hear you. Did you lose signal?
No, I still have you guys.
Okay.
Can you just not see my presentation?
Yeah, it's not visible now. We're fixing. So please.
Okay.
Please continue.
So with the flu trends, what we basically did was looked at the number of queries that were happening around flu-related data, and found that we were actually able to use the queries happening, and the 2 weeks prior to a flu breaking out in a certain state in the United States, we could actually predict that the flu-based behavior would actually happen because of the fact that the queries actually, the number and the volume of queries happening around this particular health condition are happening at such a rapid pace. And what Google.org's mission is to try to solve for global health issues, and flu is the first way that they're looking at trying to look at predictive models and how that might impact things across the world. Looks like we're getting signal again. And I'm just going to continue for now, as long as you guys can hear me.
It's perfect now.
Oh, you can see, great, perfect. Another issue that obviously affects consumers globally is having electronic medical records or personal health records. So another way that Google has committed to trying to solve for this challenge is by creating Google Health. And I'm sure some of you have heard it or read about Microsoft has also created a health vault, so that both companies are really working in tandem to try to solve for the issue that consumers have of portability with their medical records. And so Google Health is still in beta, but it is allowing consumers a way to engage with a property where they can actually upload all of their content. And we've created partnerships with several health providers as well as care providers to try to allow consumers an easy way to be able to upload this information. Our partners in the pharmaceutical space are asking us, how can I get involved and how can I make an impact here? At this point, we're really trying to focus on the non-commercial aspect of this, which is the way that Google launches most of our products. We usually start with a non-ad supported product, and really we believe that if we can create a product that's valuable to the consumer audience, then eventually there may be a place for monetization. In addition to that, our commitment to the health community expands trying to really understand the challenges from a global basis of what are the issues that our health companies and providers need to help improve upon patient outcomes. So we've partnered with over 20 different people to create a health advisory council from foundations, universities, top health companies to really consult with Google's product development team to help try to really influence the way that our products can help solve for the health challenges that are around the world. So from a product basis, I wanted to just give you kind of the framework of why health is so important to Google and why Google believes that health is so important. And I want to switch gears and talk about really from a marketer's perspective, how do global healthcare marketers get involved and communicate with the audience that's online. We know that for pharmaceutical companies, the big challenges are how do we get patients to request the specific prescriptions that we want them to be able to take? How do healthcare providers and physicians, how do we get to influence them with more information? We know that time with sales reps is going down, and doctors are not allowing physicians or sales reps even in their offices. So how can we get them that information? And we know that from a global basis, that in order for pharmaceutical companies to grow and expand their prescription footprint, they have to think global. So really, we've seen an uptick around solving for global marketing issues. Really, even within the last year, there's been much more interest around this. So what I'd like to talk to you about are 5 things that you can think about taking away and thinking about how your company can solve for this and think about changing your marketing strategy to align with this in the next year and years to come. The first is just really realizing that your audience is online and consumers and physicians are searching for health information. The second is the role that search plays in this and how critical it is for you to be able to communicate with people as they're raising their hands and asking questions about health information. The third is that blogs and social networks are expanding globally, and they are here to stay. And while it is a challenge for many companies to figure out how they should be getting in the game because of the regulated environment that especially the healthcare sector is in, it's still important to realize that there are safe and effective ways to be able to communicate with people as they're engaging in these mediums. The fourth is the importance of online video and how it's just expanded in terms of interest and reach. And last but not least, data. Measurement tools really can make a big world small, and the importance of measuring all of your efforts. First, just to give you some context in terms of the global market, internet has obviously become not just a phenomenon, but an integral part of everyone's lives. If we look at media consumption globally, television and print used to be the dominant sources of information for patients and physicians. Today, internet has become much more accessible, and the time spent with the online medium, in many cases, is equal or more than people are spending with television. When you look at reach, consumers are everywhere. If you look at Latin America, Google's reach is 88%. In Europe, we have 77% reach. In Asia Pacific, we're at 52%. When you look at our unique visitors, especially focused on a search marketplace, Google dominates in a global marketplace with over 656 million unique visitors. And the reason for that is people really are researching and curious and wanting to find answers to the questions that they need in their daily lives. To look at the growth that's happened from 2004 to 2010, the number of search engine users will double between 2004 and 2010 globally. If we look at some data points to put that into perspective, just in 2007, 87% of U.S. physicians were online and 65% of U.S. adults. And they were researching information regarding their health, medical, or prescription drug information. And the reason that search is so important is because it has an entry point to helping consumers and physicians finding information. This is a couple data points to put that in perspective. There were 4.6 billion searches on health-related keywords in Q4 of last year. That's 111 million individuals looking for health-related information, and 45% of health traffic was referred through search. That means that almost half of people go into any sort of health-related site, whether it be your portal, your to health information, any of the brand.coms that you've created, are really coming through search and then ending up there. And health professionals are online, and they are connected, and they are starting with search. To put some perspective on it, there were 8.7 million healthcare professionals in the United States. 7.6 million of them are online. 1.65 million of them are the hyper-connected, right? So those are the early adopters, the tech-savvy physicians who are using the internet more than 5 times per day. Many of those are e-prescribing, they're using their tablets, and they are, communicating with their patients through email, etc. They also are looking for content online. In the past 30 days, 1.3 million watched an online video. And this phenomenon is not solely happening in the United States, but it's happening globally. If we look at some recent data looking at the European market, European physicians search 60% of the time using search first to look for health professional information online. Again, search is the gateway to finding the content that they need on professionally driven websites and portals. Many of you, I'm sure, are familiar with the New England Journal of Medicine, and the New England Journal of Medicine was also curious to understand how doctors were finding medical journals online. They conducted a survey to understand where referrals were going to from search engines for 844 medical journals. So these are the specific journals that physicians are reading and researching. And they found that 56% of people going to those 844 medical journals found those journals through Google. So really, again, the importance of search being the first touch point to where then physicians are finding information. And while direct-to-consumer advertising is only allowed in the United States, patients are not alone in the United States in trying to understand what's happening to them along the patient pathway. So, although you're not allowed to communicate with them directly about your brand, people at all the different stages along the pathway are trying to research and find information. Whether it is when they're undiagnosed and looking for symptomatic or asymptomatic searches, looking for heart pain or leg pain, or whether they've been diagnosed by a physician and are actually then coming back and trying to understand what does this diagnosis mean and what are my treatment options. Or for those that are treated and those that are on script and either deciding what are the side effects of this script. Are there other options that I should be switching to? Are there, things that I should be thinking about in regards to compliance and adherence and staying on script? So it's really important to think about how can you have an impact on them as they're going through that patient pathway and looking at that information online. We tried to understand better about how patients were impacting at each point of the patient pathway. And what you can see by the research we found here, a couple of key things to take away. When people are looking for information is, 58% when a family or friend has been diagnosed with a condition. So really the importance of the caregiver or of the family member in health is extremely important in terms of helping educate those people at the point of learning about a condition, as well as you can see 70% were searching for information after being diagnosed with a disease or condition, right? So for you as healthcare marketers, that becomes really the integral point that people are going to be making decisions about what their treatment options should be. One of the second largest trends that we just that is true globally is that search is a core behavior. People are searching for things across media, right? So whether it be that you're searching online, now searching for information using your TV through all of the DVR sources, searching on mobile devices, which we've seen a tremendous increase of, or searching on for things within your own home devices. And physicians are searching for information as well. Healthcare marketers say, Google is a consumer portal. It's not where physicians would go to look for information. But in fact, we found that physicians are people too, and they're looking for information. They just look for things differently. They look for information based on clinical terms. They look for information based on the generic terms of drug names. And through Google, as you can see in this example, AstraZeneca is running an ad against beta-2 antagonists. And they are specifically having messaging that says, this is an ad for a healthcare professional, and you can find healthcare professional information at our official site. While television advertising for consumers is, again, not something allowed outside of the United States, I wanted to just show the impact that offline events have on search. And the recent Merck Gardasil launch was a great example of that. They started their campaign doing disease awareness and trying to educate consumers on HPV. When HPV launched, with the Tell Someone campaign, you can see that it had a direct impact on an increase in search volume on Google. In addition to the unbranded condition awareness campaign, they then later launched the Gardasil campaign to let consumers be aware of it. And you can see again the One Less campaign launch happened on television, and there was a direct correlation of an increase in search events happening in Google. We see in the United States market that not only does advertising have an impact on search, but public relations, television shows also have a direct impact. I can tell you